Hey, this is Jessica Shafi. This is my second attempt to the wound care video. So I'm going to move my camera down and try to reposition this. One second. Okay, so I repositioned it so that way you guys can see it better. Oh, sorry, let's get that out of the way. So here I have my wound. I used the Tegaderm last time, also when I was previously using it for practicing, and then it stuck to the wound. So this is my new bandage, and then I'll show you also a little bit later the new bandage that I have in there. I'll explain that it would be Tegaderm. This is my biohazard bag, my clean gloves, and then my sterile cleaning supplies. So I'm going to treat this wound as if it was my patient. So I'm going to come in. Hi, Mr. Jones. My name is Jessica. I'm going to be your nurse today. Can you tell me I'm going to close the curtain actually real quick and close the door. Can you please verify your name and date of birth? And then I'll check the band. Everything looks great. So I'm going to explain to him what I'm going to do. So right now I'm going to go ahead and remove your old bandage, and then we're going to assess your wound, and then I'm going to do a new bandage on there, okay? Okay. So then I'm going to do hand hygiene. I'm going to wash my hands really well. I'm going to put some clean gloves on. And then we're going to remove this bandage. So I'm going to start in one corner and slowly go with the hairs and away from the wound. We're going to take off this bandage nice and slow. We don't want to make the patient feel uncomfortable. Perfect. And then we're going to toss this in the biohazard bag. Then we're going to remove these gloves. Throw them in there. Next, what we're going to do is open up this. We're going to do another thing of hand hygiene because we really want to make sure that our hands are all clean. So I'm going to remove, we're going to scoop this over real quick just so you can see hand hygiene again. We're going to remove the top here, and I have done this a couple of times, so it's not exactly nice and tidy, but we're going to take out our sterile gloves using the two 1-inch margins here. Using my dominant hand, we're going to use my non-dominant hand. We're going to pinch the corners here of the cuff and slide my hands in there. Then we're going to take a few fingers here inside the cuff. We're going to slide our hand in here as well, just like that. Next, what we're going to do is we're going to clean the wounds. So using this is going to be my clean hand. I'm going to drop this. We're going to clean the inside of the wound, inside to out, and drop it in there. Next, I'm going to do extra cleaning, and I'm going to use this. We're going to pop it, and then we're going to go inside to out. And then biohazard. Next, we are going to dry it. Here we go, drop it in there, and then I'm going to inspect it. We're looking for odor, color, any kind of pus, anything like that. Anything new, we're going to measure it if applicable. And everything looks good. Next, we are going to apply the dressing. So I have the Tegaderm wrapping and all this. I just put a little bit of tape in there to pretend that the outer part is the Tegaderm, and then I can remove the edge so that way it looks like as if I was gonna use a Tegaderm. So we are removing the Tegaderm. And then we are putting that Tegaderm right on there. We're making sure everything is nice and smooth without hurting the patient. Everything is nice and smooth and flat, and it's nice and tight, and it looks really good. The edges are nice and smooth. Then we're going to take this part off. Biohazard. Next, I'm going to go ahead and remove these gloves. We are going to remove all trash, biohazard bag, and then I'm going to do some hand hygiene. Next, I'm going to make sure, are you comfortable? Does everything feel good? Does everything look good? They're going to say yes, hopefully, and then I'm going to chart that I did all the patient's wound care. Okay, thanks.